All right, let's keep talking about hospital capacity. I want to revisit a question we got from a viewer named Celeste. She wrote, yes, hospitals are full, but have we talked about the fact that Oregon has the lowest hospital beds per capita in the U.S.? Celeste, you're right, they are full, and you are right, we're not talking about it enough. So here we go. This is a list from the Kaiser Family Foundation of hospital beds per capita in each state. The data from 2019 before the pandemic hit. You can see at the very top there, South Dakota with the most beds per 1,000 people, but then scroll all the way down to the bottom, and you see Washington and Oregon tied for last place. How'd we get here? Well, I checked with the Oregon Association of Hospitals and Health Systems. They say it all started back in 2012 after the Affordable Care Act was signed into law by President Obama. That allowed then Governor John Kitzhaber to create what are called coordinated care organizations. Those are groups of healthcare providers focused on helping people manage and prevent chronic conditions and diseases here in Oregon. The idea is to stop people from needing hospital care in the first place. So because of that, the state regulates the number of hospital beds, so there aren't a bunch of empty ones sitting around. If a hospital wants to expand, the state has to make sure the extra beds are actually needed in that area before signing off on it. Dave Northfield from the association told me this system works great until you have a pandemic combined with a hospital staffing crisis. The system created one of the lowest per capita hospital bed numbers in the country, and it used to be talked about with pride. Now we know it can be a problem. Now, we should mention adding more beds right now won't necessarily fix the problem we're having during the surge. Beds need to be staffed by workers who can actually care for patients. And, as Dave mentioned, there's a big hospital staffing shortage in Oregon. To make matters worse, the Oregon Nurses Association has warned the state's vaccine mandate is going to contribute to that shortage. Healthcare workers in Oregon are required to get the vaccine by October 18th or be fired. Well, Peace Health, which has medical systems in Cottage Grove, Eugene, Florence, and Springfield, had an even earlier deadline this past Tuesday. And the Oregon Nurses Association says more than 100 Peace Health nurses are now on unpaid leave because they have not gotten the vaccine. Some workers staged a protest outside Riverbend Hospital in Springfield this week, leaving their shoes outside the front entrance.